You're watching Morning Live. Thanks so much for being with us. Now, the alarming rise in numbers of COVID-19 infections in Gauteng has opened up thoughts on whether the province should introduce an intermittent lockdown or continue with the current regulations. Gauteng Premier David Makhura and the health department in the province have been cautioning of a rapid increase in infections, with certain townships becoming new hotspots. Now, with the supplementary budget proposal of 21.5 billion rand for COVID-19 related healthcare spending nationally and a further 12 billion rand allocation for services at the frontline of South Africa's response to the pandemic, will the province be better able to equip itself to deal with this oncoming storm, as it were? And joining us now to discuss this is the Gauteng Health MEC, Dr. Bandile Masuku. Thanks for your time. Welcome to Morning Live.
Good morning, and good morning to your viewers, and thanks for having us on your show again.
Dr. Masuku, let's just start with an update on the latest statistics pertaining to Gauteng.
Our statistics are rising. We are expecting to surpass Western Cape by end of the week in terms of active number of cases. And it's something that we were expecting that it will happen, but it was not expected to happen this soon. It was supposed to happen around July, around end of July, in terms of our modeling. And at the current rate, we are seeing that we are having a fast increase, and it's something that concerns us, and it's all related to how the behavior has turned out since the lockdown level 3 has been instituted.
So, as you say, perhaps reaching this stage sooner than anticipated, what do you believe are the drivers behind this?
I think there are a lot of issues that relate to the behavior of the community and the society around Gauteng, where they've actually engaged in a blatant disregard of the regulation, particularly the regulations that regard to crowd control regulations. We still want to see them being strictly applied. And the second one is just the interprovincial movement that was allowed, and it has increased drastically. Some of the infections and outbreaks that we have seen are actually related to people who have visited other provinces, attending funerals, and then coming back having been found that they're infected.
MEC, you speak of a blatant disregard by Gauteng residents of lockdown regulations. Is there something more that perhaps government could have done to ensure that people actually adhere to the regulations?
We should be continuing to doing it. It's not supposed to be in a past tense. It's supposed to be in a continuous, actual present tense, that we have to continue to enforce these regulations. And I think one of the discussions that we've had with our Prof joint, which is the security cluster, it's how we can be able to enforce some of the regulations. The ward-based approach also is aiming at assisting us in doing that, to make sure that the communities do adhere to the regulations, because these are just simple things that are in our disposal that we can be able to do just to control the rate of infection. It's an important aspect in how our system will actually cope with the infections.
So given that you're saying that the modeling that was done has now basically gone out the window, what are you expecting now in terms of the predictions of how the infection rate is going to rise in Gauteng? And do you have any time frames that you can share with the viewers with regard to that as well?
No, it's not totally out of the window. The issue is that it also gave us an understanding on how the gap will appear early on in July, and how the peak might come closer to just mid-August or end of August. And remember that the initial the modeling was actually saying that we would have the peak around September. So the issue is how we we can increase our rate of implementing our plans, in making sure that the system gets ready and jacked up in that regard, and meet the gap that is obviously opening up now.
So what are the anticipated figures of Gauteng dealing with the COVID-19 pandemic? What sort of numbers are we looking at?
We're looking at 120 by end of July, which is something that will be quite problematic. We take solace that the majority of the individuals who are infected, won't require any medical attention or medical help. And we also think that, that is something that is holding true even currently with the figures that we are seeing of the active cases. Only around 3% to 5% of them are actually in our facilities or requiring, attention. But that doesn't mean that the plan of putting up the field hospitals and putting up extra beds actually will stop. We are going to continue implementing it because the action is still in action. The plan is still in action as we speak.
So speaking of those who may require further attention, how is Gauteng coping at the moment with the rising numbers in hospitals at this point?
Undeniably, there is a pressure and there's pressure in our facilities. We are just perfecting the system of managing the beds between ourselves and the private sector to make sure that we have a system that is functional. We have started using that system, and the team started meeting last week to see how we can sequence the usage of beds and the usage of resources that we have, so that we don't have all facilities being packed up in one time. We're able to give others an opportunity to actually have a space to relax and also have the space to work up their patients. So it's a matter that we need to perfect as we go and make sure that the system becomes actually flawless as we go.
MEC Masuku, we've also heard of patients who say that they are in need of assistance and they're being turned away. Are you aware of this? And if in fact you are, how regularly is this happening?
That's the point that I was making, that we need to do a proper bed management. We are aware of some reports, and some of the patients had to be placed in other hospitals. So it's an important aspect that when we have this system of bed management, it makes it easy for the EMS or the family to be able to be directed to a facility that has a bed available. And the second part is also to increase the capacity of our emergency and accident departments, which tend to be mostly, a waiting spot or waiting area for those who are waiting for results, for them to be allocated beds within the facility. Hence, it's an important aspect that we are dealing with now as we perfect the bed management system. And it's something that we would have to continue to implement and perfect as we go, as we see the flaws and the weaknesses of the system.
And speaking of the weaknesses in the system, there are also a number of complaints that we receive as well, where people are talking about the tracking and tracing method, where they have been exposed and are not being allowed or given the opportunity to be tested for COVID-19. Again, are you aware of this, and how does this impact on the statistics that we actually have at the moment? Are we in fact underreporting the rate of infections?
It could be. It's a known given that there would be people that we don't really count and that we don't have an account on, particularly those who don't have actually symptoms and who are not even aware that they've went across or came across somebody who was infected and they are actually contact. But in the context of the shortage of test kits, the test kits are now only put out for those who are in hospital, who require assistance in hospital, who are sick with symptoms, and for the healthcare workers who are in the front line. And for those who are confidently knowing that they've been exposed, we advise them that they should actually self-isolate for the 14 days. And then, after that, they will be considered recovered and the case will be actually closed. So the issue is that we won't be able now to test everyone, since we have moved into a more of a focused area of testing those who require help. And it's something that we are working on at the current space.
What are the concerns around that, and fully appreciating the factors that you've just mentioned, MEC, and some of the shortcomings? When you hear of someone who perhaps goes to hospital and 2-3 days later they die, that raises concern about the lack of testing perhaps, and that people are dying when they perhaps could have received assistance earlier had they been given the test that they asked for.
No, I think the basic logic is that you can ask for a test, and when you have symptoms, you can come across and you can be able to get a test. But if you are not having any symptoms, you are quite well, and you obviously, it means that you can consider yourself. And this advice that we give of people self-isolating or isolating for that matter, we give them facilities, we avail facilities for them to isolate. You know, it's a matter that says that we should be, when you start to develop symptoms and you require assistance, it's then you can be tested. So it's obviously something that would also have weaknesses, but it's workable, and it's saving cost, it's saving the resources that we have in terms of testing kits and availability. Hence, there's a big discussion about using serological testing, but not for diagnosis, but also to check for those who have been exposed actually to the virus, or who naturally would consider them as being immunized.
So looking at what the Premier said not so long ago, MEC, saying that townships and informal settlements are now the new hotspots, what are the patterns showing us? Where exactly in the province are these hotspots?
I would consider that the whole of Gauteng as a province is a hotspot, because all the sub-districts in the province are actually having more than 10 active cases as we speak. And it might be difficult for us to say we're focusing at a particular area. Yes, there are areas of concern where you have a high number of active cases, particularly around Johannesburg and Ekurhuleni and Tshwane. And these are areas that are of great concern. And we still have a look, we are putting our eye on the Merafong area where the mining activity is actually happening. And we are seeing that there's a slow increase in their infections rate now. But the whole point is just to get us to understand that the whole province is a hotspot. We just have to take care of ourselves where we are and be able to seek help when required. And one thing that I need to say is that we don't need people who are well in our facilities. It's important that people who come to facilities are those who actually require help, and they are in a real sense sick.
And speaking of those, the question then becomes, will Gauteng have the resources to deal with what is to come? You spoke about the issue of the beds. What about oxygen and, the staff complement at the moment? How is all of this affecting them? Ventilators, for example. Will the province be able to cope with the numbers that you are predicting at the moment, MEC?
The numbers that we are looking at in terms of modeling, we had a discussion with the companies that supply oxygen, and they've given us an undertaking, and they've also created extra storage capacity in most of our like hospitals. We did extra work in some of the hospitals like George Mukari, where we had to put more extra oxygen points. But also the fever tents that we're putting up, which will relieve our accident and emergency tents, will also have the capacity to give oxygen, because whilst you wait for a bed, you need still to be actually given some form of intervention. So at the current rate, and what we are actually dealing with, we are clear that we would be having oxygen, but it's something that we'll have to continuously monitor as we go forward.
MEC, you also spoke about the province perhaps looking at intermittent lockdown. What is your view exactly there, and why would you suggest that?
The issue is that we need to apply the regulations in the strictest form. Some of the regulations still need to be applied to slow down the rate of infections, and one of them is the one on crowd control regulations. The second one is just introducing the issue of the curfew. And the third one is around the issue of alcohol and the times and the regulations. And the fourth one is the interprovincial traveling. So these are some of the regulations that we think that will help us. When we talk about intermittent lockdown, we're talking about taking some of the regulations through and from different levels, from level 5 and level 4, and applying them to reduce it. But in the description, as it described in the scientific world, it does give a time for the healthcare system to be able to replenish itself over a period of 2 weeks. And those who have been infected also give them an opportunity whilst everything is still and quiet to do that. But the issue is that the business sector has raised concern, and it's something that we still also have to consider, particularly those in the mining sector who said that they might have some hazards when we work stop with them.
And of the 21.5 billion rand that was announced during the supplementary budget, how much of that allocation will be for Gauteng, and how exactly will it be utilized?
I think with the issue, I wouldn't be able to say how much, but what I can tell you is that we will be utilizing it to continue to acquire more staff, as we have been asking, that how have we been doing. So the issue is contracting more staff, and we are continuing to do the same process and creating that extra force that will buffer when some of our staff members get infected and they have to be laid off for some time, and also to buffer for those who are fatigued and actually tired. So that will be a major part of the the work that this budget would be, but also to put up and equip the field hospitals. And as we are talking now, the Nazareth Field Hospital is coming into shape, and the one that in Sinaba that we are doing with the South African National Defence Force is also coming into shape. So it's clearly that we are going to use these resources to actually cover the basic needs that will be required to deal with the pandemic in that space.
Well, we'll leave it there. Thank you so much for your time this morning. And that was the Gauteng Health MEC, Dr. Bandile Masuku, talking to us about both the current and future rapid increase of COVID-19 infections in Gauteng, and basically saying that all of the province is currently a hotspot. So let's take that to 8 o'clock.